When we think about our journey since 6 years ago, so M-TIBA today has about more than 4.6 million users across the platform. We are in over 4,000 healthcare facilities. We started in Kenya, we are in Kenya and Nigeria as well. But when I look at it, the impact that we've had, we have seen the cost of healthcare going down for various health insurance and payer schemes that have been on M-TIBA. Now, this is important because it enables payers and specifically insurers to develop products that can be affordable and can be accessible for the mass market segment. Because, as I said earlier, the reason why we started M-TIBA, the reason why we started this journey was to make sure that millions and millions of people are able to access healthcare when they need it. And this is through health coverage. So what we have seen as our impact is that we have been able to work progressively with payers to develop products that are now that are being accessible in the affordable market segments. We've been, as I said, through Cash Advance, have seen some of the smaller hospitals or smaller providers really expanding and growing and serving their communities. We've seen, for instance, a facility that now, initially when they started, they had 10 beds, and now I think they have almost around 100. And this is through the growth of the solutions that we offer on M-TIBA. So at the end of the day, we've seen quite tremendous impact that we are making, all of it geared towards increasing access to affordable healthcare. When I now think about our future plans and what does that look like, as I said at the beginning, our goal is to really drive access to healthcare. And we believe our next wave and what we are all striving towards is to get millions and millions of people to be able to access healthcare and to be able to have, and this we are doing through various ways, through making sure that more people are able to get health insurance coverage. So working with insurance partners and the platform and the hospitals who are the providers to make sure that we are able to have affordable health insurance solutions in the hands of every Kenyan, so that every Kenyan, particularly when we talk about Kenya, so that every Kenyan has a health plan that when they are unwell, they can go and access services. So we will continue to work with working together with more payers, so more insurers, more hospitals in this journey of making sure that healthcare becomes accessible and affordable for most Kenyans.